The association that I work for is a community-based health center, and we try to improve everyone's access to care and provide quality to care to all people, regardless of their ability to pay. So we thought by going into the schools, we would have a better chance to reach more people.
So the children are very engaged and very happy. And usually they want to take the dental forms home to their parents that moment, but I have to give them to the teachers. When I come back to do the work, they remember me, and they're quite happy to have me, working their mouths. They open wide. I tell them the different things that, I'm going to do while I work, and I actually bring some of the toys that we use for demonstration purposes with me.
A lot of the kids do not ever go to the dentist until they're adults, maybe, and the sealants are important because there's little pits and fissures in the back molar teeth, and those are the first ones to get cavities. And usually the first molars come in when they're about 6 years old, and then those teeth will be in there the longest.
All dental disease is 100% preventable. You just have to have the education, you need to have access to the care, you need to have the fluoride, you need to have the sealant. So instead of having a cavity or having an infection or an extraction or a root canal and all that, why not just prevent it by placing just a real easy dental sealant?
As these permanent molars are erupting, we're trying to seal them before they're decayed. We might see a student that every single one of their primary teeth have decay on them, but their molars are just starting to erupt. We can get them sealed before they're decayed. These teeth are going to be in their mouth hopefully for a lifetime. It's a preventative measure rather than restorative.
Decay and oral health is related to heart disease, diabetes, all kinds of different health issues.
If there's an infection in the mouth, that infection is throughout the body. The body is constantly fighting an infection.
Infection in a tooth, which can turn, it starts as a small cavity, it can turn into an abscess, and a lot of people don't realize that. Children have died in the United States because of abscess teeth, and there's no excuse for it because it's totally preventable.
Unless you've talked to somebody or have experienced the pain when you have an abscess tooth or a bad tooth, the pain that they're in. And kids, when they're in school feeling that pain, that's all that they can think about. They're not thinking about the math, they're not thinking about the reading, they're not eating well, they're not sleeping well at night when you're laying there with a throbbing mouth, so you're not getting the rest that you need. And it plays into the overall health of the child.
Some of the first graders we've seen as second graders, we have not seen any new decay on the teeth that we've sealed, so that's a sign that we're heading in the right direction.
It's very important to make the children happy, both in the classroom and during treatment. If you can do that, generally they'll make sure that when you return for the next school year, the class behind them will participate. And it just makes everything so much easier.